In this lecture, we're going to conclude our coverage of cancer by examining some additional clinical considerations, specifically zeroing in on a research study examining a particular type of fruit extract on cancer cells. And then we'll just go over a quick summary of issues related to exercise. And the question always arises is that can certain foods prevent cancer? And one particular type of fruit that has been examined is alma, or the Indian gooseberry. And this is a fruit that is available in Canada and North America. And this fruit carries with it a claim that it possesses anti-diabetic, anti-inflammatory, and anti-cancer effects. From a nutritional perspective, the Indian gooseberry is considered to be a good source of vitamin C, but it also contains phytochemicals. And as mentioned in a previous lecture, phytochemicals are nutrients, but these are not macronutrients and these are not micronutrients, but are plant chemicals that have potentially therapeutic benefits. And the specific phytochemicals listed here are thought, as well as triterpene luteol is another type of phytochemical, and it's these phytochemicals that are thought to have the anti-diabetic, anti-inflammatory, and anti-cancer effects. So in this particular research study, we have the reference here up top. In this study, they sought to examine the effects of the extracts from the Indian gooseberry on cancer cells. And they studied the interest here was the human papilloma virus, or HPV. Now, this is a virus that if females contract this virus, it does account for a significant number of lesions due to cervical cancer. And the aspect to this is that activator protein 1, which is a transcription factor, will increase viral gene expression. And so this particularly becomes a problem if the virus infects cervical cells that would increase the expression of that virus that can cause the cells to become cancerous. Now, in this particular study, the researchers took Indian gooseberries and extracted the phytochemicals. And then once the extracts had been removed, those phytochemicals were used to treat cancer cells. And the interest here was to determine if there was any dose dependency. So in any research study, dose dependency refers to the observation that by increasing the amount or the dose of some substance that's applied to a person or to some cells, as it is in this course, the effect will be greater. And so the interest was to examine if the extract caused stunted cell growth, which is ideal here because the cancer cells that were studied would continue to grow, as well as the shrinkage of those cells. Cells that get smaller are a sign that the cell is undergoing apoptosis, or pre-programmed cell death. And the image below, what we're looking at here is the dose dependency outlined along the top here. So the extract indicated here is increased in concentration in a number of different conditions. And what was specifically examined are two unique types of cancer cells, SIHA and HeLa cells. And these two types of cancer cells are used extensively in research to examine different factors that can arrest the development of cancer. So here we see images from a petri dish growing these SIHA and HeLa cells. Now, as the dosage of the gooseberry extract is added to the to the petri dish. As we jump all the way over to the highest dosage here, we see a much smaller cancer cells and far less numerous cancer cells. And so to summarize these effects, the study found that the extract from Indian gooseberries demonstrated both dose and time dependent effects. And the overall effect is that by treating those cells, those cancer cells, with Indian gooseberry extracts, it decreased the number of viable cells. So a cell that's not viable is one that's not going to survive, and that would indicate that these cells have died. And that's exactly what we're looking for when we're talking specifically about cancer cells. So if we take a look at the graphs here below, the graph on the left are the results from the experiments with the one type of cancer cell, SIHA cells, and the graph on the right are the results from the HeLa type of cancer cells that the researchers examined in the study. And so if we start on the left-hand side with the SIHA cells, we see that across the x-axis, as we move from left to right, we see the experimental condition where the cells that were grown in the petri dish, as a function of the dosage of the Indian gooseberry extract, demonstrated a dosage effect. So at greater dosages, the percent cell viability progressively decreased. What was also observed is that there was an effect of time. And what that time effect indicated, if we take a look at the legend here on the graph, we see that the different clusters of these cells were exposed to the extract for a 24-hour period, then measured. 48 hours later, it was measured, and then 72 hours later, it was measured. And then we see that with time, the number of viable cells were progressively lower. And so the lowest survivability of these cancer cells occurred at the highest extract dosage for the that were and for those cells that were exposed to the extract for the longest period of time, and that was 72 hours. And similar results were observed here on the right-hand side for the HeLa cells, indicating that from a more general perspective, that nutrition does or can play a role in helping to mitigate the growth of cancer cells. On this table, this is the table that summarizes various considerations for exercise testing. And the table covers maximal testing, submaximal testing, muscle strength, endurance, and flexibility. I'm not going to go over this table in great detail, but if you scan through this table, what you'll see is a wide range of possible options for conducting exercise testing in patients with cancer. And the reason that there's such a wide variability in these standards and in these guidelines is that it depends on the patient, depends upon the type of cancer, the stage of the cancer, the physical capability of the patient, as well as considering any medications or any treatments that the patient is undergoing. And so in terms of conducting exercise testing, this should always be carried out following the recommendation and supervision of the attending physician for that patient. In terms of contraindications to exercise, and these are factors that if present, would either recommend a decrease or postponement of exercise or not exercising at all. And that occurs if hemoglobin levels drop below 10 grams per deciliter of blood. This is particularly important with certain types of cancer treatment. If red blood cell and hence hemoglobin levels drop, the ability to deliver oxygen to working muscles will decrease, and that is that could be problematic for the patient. If white blood cell levels decrease, and neutrophils and platelets are two types of platelets are actually not cells, they're cell fragments, but they're all part of the immune response of the body. And we see that if white blood cell count decreases beyond these indicated levels, that exercise should not be carried out. And of course, if the patient has a fever, the exercise should not be carried out at all. So the items on the left-hand side that we see are more objective clinical measures that would mitigate or recommend that exercise not be carried out. In terms of some of the more observable signs exhibited by the, or symptoms or signs exhibited by the patient, of course, includes an unsteady gait. If the patient is experiencing cachexia, that generalized condition characterized by muscle loss, weight loss, and a decrease in physical function, exercise is certainly contraindicated. If the patient experiences an increase in breathing with exercise, with exertion at very low levels, or is not able to maintain the exercise because of the abnormal breathing, it's not recommended that the patient exercise. Obviously, bone pain, severe nausea, or extensive skeletal metastases. The problem with skeletal metastases is that if the actual bones have been weakened because of cancer, weight-bearing exercise or any exercise that will load up the bones, that will place a load on the skeleton, may result in fractures. As we covered with the exercise testing recommendations for cardiorespiratory, resistance, or range of motion exercise, once again, we see a very wide range of prescription recommendations, once again here, because it really depends upon the state of the disease and the type of cancer, as well as any medical treatments for that patient. And so I won't go over the exercise prescription guidelines in this particular case because you'll read that it is actually quite variable. So this ends our final video on our unit on cancer.